Happy holidays from us at Commonwealth Beacon. I'm Jennifer Smith, one of the reporters here. We hope the podcast is keeping you company over the holidays. You might be listening with family. You might be hiding from them. Hearing a podcast in your ears as you cower in a closet, trying to avoid conversations about politics. And Commonwealth now has a way for you to help us continue to produce more of the journalism that you hopefully love. We're in the final stretch of our Newsmatch campaign, so from now until December 31st, which is rapidly approaching, if we hit a $50,000 end-of-year fundraising target, we actually get bonus funding. So if you want to be a part of that, you can head over to commonwealthbeacon.org and click on the donate link. Have a very happy holidays, and now let's get to the podcast.
Hello, everyone. Welcome to Health or Consequences, the Massachusetts Health Policy podcast of Commonwealth Beacon and Mass Inc. I'm John McDonough from the Harvard Chan School of Public Health, joined by my partner, Paul Hattis from the Lown Institute. We want to welcome you all to this exciting conversation we're going to have today, looking ahead to the Trump administration starting in mid-January and health policy in the United States and its impact in Massachusetts. And Paul and I could not think of anybody better to come and talk with us than Amy Rosenthal, who is the Executive Director of Healthcare for All, Massachusetts' leading healthcare consumer advocacy organization and formerly of Community Catalyst. So welcome, Amy, and thanks for joining us.
Thank you, John, and thank you, Paul, for having me.
Just in case anybody in our audience doesn't know who you are, could you just give a little bit about your background? How does somebody end up becoming the executive director of Healthcare for All?
Sure. So I've had kind of an interesting career path. My first 7 or 8 years out of college, I worked in 3 large academic medical centers doing mostly injury prevention work, and went back to graduate school to get both my MPA in nonprofit management and my MPH, so that I was able to both learn how to run a nonprofit and learn about healthcare issues. I spent a bunch of time in the political arena. I worked up at the Massachusetts State House for a little while. I ran a family foundation that supported women in politics. I was a policy director on a governor's race and did a congressional race. And then I made my way back to healthcare and worked for over a decade at Community Catalyst, a national healthcare advocacy group, where a big part of my portfolio was doing federal work. So I first worked on the reauthorization of the Children's Health Insurance Program, and then spent a very long time going back and forth to DC working on passage and implementation of the Affordable Care Act. And then after some time, about 7 or 7.5 years ago, I had the distinct honor to come over and be the executive director of Healthcare for All.
Fantastic. Let me turn it over to Paul. Paul.
Amy, let me add my words of welcome. And as John noted, we're facing what will be the second Trump administration in a few weeks. And we remember the first Trump administration where there was an effort, but for Senator McCain to repeal and replace Obamacare, it failed. But as you sit here now, having observed this year's election, all the rhetoric, the even initial appointments, which we'll get to in a moment, what do you think will be the headline coming out of the early years of this Trump administration and new Congress in the healthcare area?
Yeah, well, I think we're certainly in for an interesting ride again when it comes to thinking about the healthcare space. You're right, there was certainly a lot of rhetoric around the campaign, but it is important to remember that there's a big difference between campaigning and then actually governing. And I think we saw that the first time around in the Trump administration, and I anticipate to some extent we'll see that again. We're already seeing some of the nominees kind of walk back statements that they've already made. However, that does not mean that we should be letting our guard down, because I think there are a number of things that we need to really be thinking about. Here at Healthcare for All, we remain on high alert, and we will be on high alert. And there's really 5 areas of threats that we have been thinking about the most. This is not to say that these are the only threats, and these are not to say that they're things that we think Massachusetts can't handle, but I think the things that are on our mind are, number one, efforts to undermine the Affordable Care Act, for sure. I think the first time around, as we all remember, there was this big effort to repeal the Affordable Care Act, and then through really strong, I'd argue, advocacy work. There was a shift in the narrative that we could do no repeal without replace. And the narrative went from just simply repealing the Affordable Care Act to having to come up with a solution if Congress was going to repeal it. And we still have never seen this great proposed replacement plan. I think even during the campaign, incoming President Trump even said that he had concepts of a plan, but not a plan. And so, well, I don't think I'm as worried about a full-on repeal of the Affordable Care Act. I think that there's a lot of things that can still be done to undermine the Affordable Care Act, either through changes in regulations, chipping away at it, or not enforcing portions of it. So that's kind of the first thing. The second thing, which I know we're going to talk about in a little bit, are threats to Medicaid and the funding for Medicaid. And obviously, the Medicaid program is critical for so many people across the country. And so really thinking about that is going to be important. Number 3 is certainly the very real fear that our friends from a wide range of immigrant communities are feeling right now. And the threats to immigrants, and particularly also that includes threats in their healthcare coverage, is something that we need to take very seriously. We saw that in the first Trump administration. The rhetoric has only increased since then, and so I think that this is something we need to be extremely mindful of. Number 4 is further restrictions on reproductive health care, whether it's medication-supported abortions, whether it's an all-out ban that they're proposing, or whether it's access to birth control. I think there's a lot of things that we certainly need to be thinking about. And I also would say when it comes to healthcare, thinking about trans health and other issues there. And then lastly, but not least, are risks to public health. And there's obviously a lot of talk around issues with vaccinations and issues with fluoride and the like. And so this is not to say that I am panicked for Massachusetts as it relates to all of these, but as an individual and a citizen of this country, I think not just about Massachusetts, but also think about what is happening across the country. And I think this is one of those times where I feel very fortunate to be in the Commonwealth of Massachusetts and feel fortunate to be working with so many people here who care deeply about healthcare and want to protect the gains that we've had across the board in so many ways.
Thanks, Amy. That's very helpful, and that's quite a impressive list of threats to our system. Let's talk about one of the biggest ones, Medicaid. About 80 million people across the country. It's about 2 million in Massachusetts at this point. All low income, elderly, disabled, poor families. Since the Trump administration or President Trump has taken off cuts to Social Security and Medicare, they're looking for $4 trillion to pay for their tax cuts. And we know that Medicaid is a very high target. Perhaps work requirements on non-disabled, non-elderly adults. Perhaps changing the financing formula so that states will get less money from the program, which would threaten it in many, many states that have already expanded as they're allowed to. Perhaps changing it to some kind of a block grant. Lots of different threats. Which ones do you take most seriously? And which ones do you think are most troublesome and worrisome?
So I guess all of those are things that we've been hearing about, and I think all of them are things that I'm worried about. I'm not panicked, but worried about. And so maybe we should take them we can take them each one at a time. But I guess I want to lay out at the beginning of this conversation, I will be honest with you. I have a bias, and my bias is that everybody should have access to health care coverage. And I would argue that most of the public agrees with me on that. And a lot of the provisions that you just outlined, John, are things that are designed to try to keep people through administrative barriers and financing structures to keep people off the Medicaid rolls. And so inherently, I'm coming at these issues by believing that the goal that we have, and fortunately, the goal that I think we do have here in Massachusetts, is to keep people covered. We have a culture of coverage here in Massachusetts, which we're so fortunate. And I think we honestly really saw that over the past year when the federal public health emergency ended and we started our redetermination process that went on all last year. People had to reapply to get on the Mass Health, our Medicaid program, for the first time in a number of years. You saw the administration, you saw hospitals, you saw insurance companies, you saw Healthcare for All and all the community-based organizations that we worked with. We all worked together to try to preserve as many people as we could on our mass health program, because that is a value that we have here in the Commonwealth that I am deeply grateful for. So I come into these conversations from that perspective. Work requirements to me are just another barrier for eligible people to be able to access the coverage that they need. And in a lot of ways, it actually is a way that the federal government shifts costs onto states so that they're not paying as much money and states end up having to pay more or make difficult choices. But the reality is when states get fewer dollars, people still get sick and they're still going to show up at hospitals and they're still going to need the care. And that's going to leave hospitals and it's going to leave the state and it's going to leave, most importantly, people with bills that are just not very helpful. I was looking at some of the Kaiser Family Foundation data from 2023, and it said that most of the adults on Medicaid are they're working or have a reason why they're not already working. So over 60% of people at the time on Medicaid, and this was nationally, have either a full-time or a part-time job. 30% of people were either disabled, providing care to somebody, or students. And so when you looked at it, it was only 9% of the total population of Medicaid who were either not working due to retirement, unable to find a job, or frankly, many of these people also probably have some sort of disability status, but just haven't gone through the paperwork of having it diagnosed. So when you talk about work requirements, you're talking about creating these hoops, these administrative barriers for 90% of the population. And it is really just that, it is oftentimes just a way of, narrowing the roles. There have been a few states that have tried to implement this. While I'm not an expert on them, I know a little bit. And so, Arkansas implemented it and people were getting kicked off the rolls, and there was a court case that said that this conflicted with the purpose of the Medicaid program. Georgia has had approval for work requirements. I think it's an 80-hour per month. And there's, I think, 4,000 people that are eligible to be enrolled in their Medicaid, their partial Medicaid expansion. But as of 2023, only less than 2,500 people had enrolled because they'd been unable to get through the process. Again, thinking back to the pandemic, Medicaid, and here in Massachusetts, Mass Health is a safety net program. It is there for people when they need it. And so when you lose your employer-sponsored insurance, or when you're sorting through a difficult medical issue, or you have a gap in employment, the program is there to help you. And then to put further restrictions on people at a time where they're trying to figure things out and sort out at various aspects of their life just is a goal that I don't think is one that we really want to be promoting. But work requirements is certainly something we're hearing about and certainly part of the discussion.
But could that happen in Massachusetts? Wouldn't the state have to agree to do it? Would it be possible they would try to shove it down and make every state do it whether they want to or not?
Yeah, I think that there's all sorts of options that could happen on the table through a variety of different mechanisms. I think we're going to have a couple of rounds of debate around Medicaid. I think we're going to have a discussion in 2025, as you mentioned, the tax bill is set to expire at the end of 2025, and we know that the incoming president is going to want to renew those tax cuts, and the pay-fors are hard to come by, and Medicaid is unfortunately a target, I think, for some of that. So I think that there's going to be a set of debates around Medicaid in 2025. And then I think each of the states, as they go through their Medicaid waiver process, what they call an 1115 waiver process, is going to have then another debate about what the Medicaid program looks like. And for us, that's not going to be until 2027. Now, I do just want to remind all of us that the House is being controlled by a very narrow number. And that means that if the Republican Party decides that they want to go down the path of doing some of these provisions, they are going to have to hold on to every single one of their members and not have any kind of defections. The bottom line is when you put in work requirements or you block grant Medicaid so that states have to make difficult choices and either cut provider rates or kick people off the program or change the benefit package in some way, those have real world implications on people. And whether you're a Democrat, whether you're a Republican, it is very hard to be the governing body and have people either lose their health care coverage, lose their benefits, or not be able to get the care that they need. And so, again, this is where I think the rhetoric can be one thing, and then actually doing this can be another. And so I think that this is where the opportunity for people who care about the Medicaid program to have their voices be heard, to talk to their members of Congress, to make sure that they're doing whatever they can to talk about the importance of these programs cannot be underestimated.
Let me build on that then, Amy, for a group of folks that get some additional government subsidy, but not as Medicaid recipients, but they get it under state exchanges like ours, where they're subsidized under Obamacare, and those are subsidies that actually grew during the COVID era after President Biden in 21 and 22 expanded those subsidies. They're all expired to end the end of next year, the end of December 2025. What's your predictions there of what's going to happen with those enhanced subsidies through the exchanges?
Yeah, I think that's just another important funding mechanism that we have to support our healthcare programs. So I think anytime you talk about whether it's Medicaid funding or the enhanced subsidies, you run risks when that money is no longer coming into states. But again, I would just also say that for states that lean red, they also rely on those. And for many of those states, or some of those states, they never did their Medicaid expansion. And so these enhanced subsidies play an outsized role in those states. And so I think again that people are going to have to really make difficult decisions as to whether they want, congressional members are going to have to make decisions about whether or not they want to limit the amount of dollars coming into their state that pays for healthcare under their watch. And for, I would say, the Republican Party, where they're controlling the White House and controlling both branches of Congress, I think then, the spotlight is on you in those moments. And I think that people are going to have to make choices. Do they want people to fall off coverage? Do they want people to have greater costs for themselves and their families? Or are they going to take steps to try to preserve this? And I think some of the things that we've read is that while I think there's been a discussion in the past couple of weeks in Congress about whether they can extend those enhanced subsidies, and my understanding on that is I think maybe that has fallen out of the discussion in this current bill. I don't know that means for sure that it's off the table for next year, because I do think these are difficult choices that people are going to have to make.
As a follow-up, I mean, you've been talking about the potential harm to consumers, individuals who would be covered, but you also alluded to that the provider system, there's a huge financial flow at risk, not only for our providers, but those across the country. Any thought about, how are they and consumers likely to work together on dealing with some of, a wall of resistance to some of these proposed changes if they come forward?
Absolutely. And, again, this is where I'm so thankful to be here in Massachusetts. We have a coalition that Healthcare for All and the Blue Cross Blue Shield of Massachusetts Foundation co-led back in 2017 that has kind of reinvigorated itself and already met once. And it's made up of a large group of people, of entities, of hospitals and insurers and advocacy groups. And I think that this is a place where we are fortunate, business leaders I neglected to mention. We all care deeply, again, about this culture of coverage. And I think that there are tremendous opportunities for groups across the spectrum here in Massachusetts to work together, to share stories, to talk about why these programs are so valuable to Massachusetts and also to people across the country. And I anticipate that will continue to happen in the next couple of years. And I think, one of the things we pride ourselves with at Healthcare for All is that we could be working with one industry group in the morning on a partnership of some sort, and then maybe fighting with them in the afternoon. But because we are colleagues and we share similar goals in so many ways, that it makes it possible for us to work together. And I think that this is certainly going to be one area where we'll see that.
One of the areas that people in all 50 states are worried about, including Massachusetts, is the very high cost of prescription drugs and how much they keep going up. In 2022, in the so-called Inflation Reduction Act, the IRA, President Biden won passage for the first time of an allowance for the federal government to negotiate drug prices with the drug companies. And that's been moving forward. It's been implemented. It went through its first round last year. But people are worried about what will happen. Some Republicans say they want to get rid of it Do you have any thoughts, ideas, hints, clues about what might be happening, good or bad, in terms of continuing pressure on rising prescription drug costs?
Yeah, I mean, I don't know much, but I think one of the things to really think about is that, the Inflation Reduction Act provisions are phased in over time. And John, as you know so well from your time working in the Senate, is that for budgeting purpose, when Congress does this, they're factoring in those savings to the Medicare program over a number of years. And so when you do rollback legislation, then there becomes a budget hole that people will have to address. And so I do think that there's both the kind of moral reasons, the right reasons. We want older adults to be able to afford their prescription drugs. We know that drugs only work if people can afford to purchase them and take them. And at the same time, there are budget ramifications for rolling back some of these things. So again, I think some of what we heard on the campaign trail, it's hard to know how much will be actually taken up versus how much is rhetoric. I think we've seen in our own state data that the cost of prescription drugs is very high. We here on our helpline, for those of you who don't know, Healthcare for All runs a free consumer helpline. We take about 23,000 calls a year in 5 languages. And we hear all the time from people who are struggling to pay for their prescription drugs. And so I think, again, this is a question of, are we going to continue to try to make it easier for people to be able to take the medications they need, life-saving medications, or is it going to become harder and create a challenging budget situation for Congress?
Let me turn to the public health side and some of the nominees that are about to be debated and include Robert Kennedy at Health and Human Services, Dr. Oz for the Center of Medicare and Medicaid Services, Marty Makary for the FDA, and Dr. Weldon for the CDC. Without going through each of them individually, what are your worries, if any and all go through?
As someone who has a background in public health and has the privilege of working with graduate students who are getting their master's in public health with a policy concentration, I think a lot about public health and I think a lot about policies. Things like fluoride in the water are some of the greatest public health victories in our lifetime. And the idea of rolling back some of these advancements is, to be honest, somewhat mind-boggling to me. So I think the confirmation process is certainly going to be interesting. I also think that there's also this notion that is hard, at least for me, to step away from, which is comparisons, right? So you look at the current CMS administrator right now, a woman named Chiquita Brooks-LaSure, who in my mind is just a brilliant thinker. She knows so much about health policy. Healthcare for All is so privileged that we had the chance before she went into this role to work with her, and she actually helped us with formulating a lot of our healthcare affordability provisions that we've been advocating for here in Massachusetts. She's a strong listener. She really cares so much about this work. And the idea that she's going to be potentially replaced in her role by Dr. Oz is really a contrast for me. And so I also think that there is something to be said about understanding the way government works and understanding how to move things through the process. And I think there's a number of people being proposed for key jobs who are not going to have that experience. And some of it's going to depend on if they get confirmed and then who they choose to surround themselves with and how successful those individuals will be at driving an agenda and making change and how they're going to do that. Again, this is one of those areas where if they say you don't need to mandate vaccinations for public school children, I'm going to be very thankful that I live here in Massachusetts because I feel confident that our leadership here will continue to ensure that kids are getting vaccinated for polio and, everything else in between, whooping cough and the others. I will just also say that as the wife and daughter of pediatricians who both specialize in developmental pediatrics, the continuous link to vaccinations and autism is one that deeply concerns me. And so, again, the confirmation process will be very interesting. And I think that this is also one of those times where people on both sides of this debate will need to make sure that their voices are really being heard, not just the people who believe those linkages exist, but the people who know that their children are able to go to school and be in a healthy, safe environment because other kids are vaccinated as well. And I think it's important for, this is the advocate in me coming out, like it's important for everyone to have their voice be heard.
Finally, Amy, you run an organization that's, for the most part, Massachusetts policy focused. And sitting here today, thinking about all the things that you've talked about and others, what would you say is on your mind about state health policy going into 2025, with all that's in front of us?
Yeah, I think I come back to some of the Medicaid issues for sure. I think this first wave of Medicaid debates, I'm hopeful that we as an advocacy group of people from across the country can fight back against those. And then I think we're going to have a couple of years until our 1115 waiver has to be renewed. And we're going to see there's going to be a lot of red states who use similar financing mechanisms to Massachusetts, that, the financing mechanisms that we use in our waiver, and they're going to go through their process, and we're going to see how those waivers are treated, and we're going to make sure that there's no difference between us and, between a blue state and a red state there. But, what I do think about is the fact that Massachusetts has been incredibly successful in covering people. We're first in the nation, and it's going to be important for us to take any steps that we can and do the advocacy we need to make sure we're on our toes and thinking proactively about what we need to do to protect that. I think people will want to work with our congressional delegation, with our state leaders to protect the gains that we've made, and also just think kind of ahead of the game about areas where we need to be either putting things into state statute or setting up commissions here to make sure that we can do things in Massachusetts that maybe, the federal government may shy away from or start to walk back from. I think simultaneously we have other things that we need to be thinking about as well, right? So we have the federal landscape, and then we have our own Massachusetts issues, which Healthcare for All has long focused on. And some of the things we touched on here, when you think about some of the data that we get from CHIA or HPC, prescription drug costs are the leading driver of costs here in Massachusetts. Outpatient hospital costs continue to be another driver. Individuals are struggling with their insurance premiums and out-of-pocket costs. People are having trouble getting access to a primary care doctor or their behavioral health services. We need to make sure that people are getting care in a language that they're able to communicate with their providers in. I think the bottom line is we need to be both dually focused on doing the protection on the federal level and thinking about what's going on here in our own state, with every industry group and every advocacy group coming to the table the way we have so many times before with this concept of shared responsibility, so that we can make sure that we're doing everything possible to fortify what we have here in Massachusetts, be strong, make sure people have the care that they need, that our institutions are financially viable and able to see the patients that they need to, that premiums are affordable, that people can access their prescription drugs. So it's a big agenda, but I do feel confident that the people of Massachusetts care about their healthcare coverage and their healthcare access and healthcare equity, and that I think by working together, we should be able to get there.
Amy Rosenthal, we've just spent about 30 minutes in a really compelling conversation. I think we could have spent about 30 hours with so much that's in front of us, but thank you so much for joining us today. Best wishes and good luck in your tough work ahead of you for the next few years. So on behalf of Paul Hattis and Commonwealth Beacon, thanks everybody for joining us, and we'll be back again next year with more compelling conversation. Thanks everybody.